is nerve pain? Basically, it ranges from like numbness and tingling, which is technically not pain per se, but that's one of the hallmarks of nerve dysfunction, to burning, or sort of a feeling of like hot water. Burning is a common word that denotes nerve pain. Electric is another word. Basically, it's pain that's evoked from the nerve itself, and it's not in response to a general stimulus, if that makes sense. We're going to get on more into that in detail in a bit here. Some people are extremely sensitive to cold, extremely sensitive to heat. Just wiping the skin like this would hurt. And then the pain is sometimes accompanied by other problems like abnormal sweating and just the skin not working correctly, nerves not functioning properly. But basically think of it as like hot, burning, electrical kind of pain. Like sciatica, probably somebody out there has had sciatica or knows someone that's had it. It's that type of pain. So the words I hear often, really you could almost say, what is that person talking about? That makes no sense. But once you understand nerve pain, it all makes sense. My foot feels like a balloon. I hear that a lot. I feel like a sock is stuck in my shoe all the time. Burning hot. I feel like somebody's poured warm water on me. I cannot wait to take my shoes off at the end of the day. Once I take my shoes off, I feel much better. My hands are killing me in the morning. They're burning and I can't even use them. I'm dropping things. I have muscle cramps, restless leg syndrome. All these things, when I hear that, I start thinking ding, 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 nerve, this is a picture of a nerve. So something's going on that's irritating the nerve itself, as opposed to, say, a broken bone or, like a true cut through muscle or something. Something's making the nerve not act right, as opposed to a true injury. Okay, so what causes it? So pain is a subjective thing. So pain is just a perception that your brain creates, and we're going to talk about how that works. Usually pain is protective. It keeps us from sticking our hands in fire, right? Or boiling water, and making sure that we jump out of the way of a moving car. So pain serves a very, very important function for us to survive, and it's evolutionarily conserved across species. So most species can feel pain, and they feel pain in certain instances, usually when it's something that's threatening to them. However, pain can occur without injury. It can happen for no apparent reason. You could have chronic pain for no apparent reason when there's no ongoing injury whatsoever. That is a much more complex thing that has to do with the circuitry between the brain and the body, and a ton of variables go into that. Pain that starts from the nerve itself is what we traditionally think of as neuropathic pain. Or neuropathy. So if it's ectopic firing, meaning like random firing of electricity from a nerve without a stimulus, without an injury, without a reason to have that, like without a cancer tumor producing inflammation all the time or crushing a nerve, then that's called neuropathic pain. And then we try to figure out what is making the nerve so dysfunctional. And there's a number of things. Oxidative stress and chronic inflammation of the current American lifestyle, probably one of the primary reasons people feel bad all the time. I mean, the diet in America, 80% ultra processed effectively, with terrible sleep patterns, pollution in the air, pollution in the water. Obviously, it's just a setup for failure, and we're all going to be in pain. So that's the first thing we can do to control it. We're going to talk about that. But poor diet, prolonged exposure to chronic low-grade inflammation, all of this leads to nerve pain. And then sometimes things like chemotherapy, different drugs for different medicines, different diseases can cause nerve pain.